So lupus can affect areas of the skin, the heart, the lungs, and the kidneys. But when inflammation occurs in the kidney, we use the term lupus nephritis. Now, lots of things can inflame the kidney. So the word nephritis is used if you had an infection in the kidney or other kinds of inflammation. But lupus nephritis is when the inflammation is from lupus. So it's really difficult sometimes to figure out that lupus actually is the cause of inflammation in the kidney. And so a renal biopsy often is performed to understand why the kidneys are behaving the way they might be, and if this indeed is lupus. So lupus nephritis, unfortunately, affects about 40% of patients who have systemic lupus erythematosus. Nephritis tends to affect individuals who self-identify as Black or African American or of Hispanic origin. Most of the people who present with inflammation of the kidney or lupus nephritis are happening really in the first 5 years. So we feel that folks who come to people who may have systemic lupus, it's the first 5 years that I think are really important to make sure that there aren't signs and symptoms of lupus nephritis. What are those signs and symptoms? Sometimes the earliest sign is fatigue. People are more tired. But if you have systemic lupus, fatigue is unfortunately one of these intangibles that are difficult to kind of gauge and to measure. But if fatigue is worsening, it might indicate that there is lupus nephritis. Swelling is a really important symptom. Swelling often will occur on the legs if the kidneys aren't functioning well. What are the kidneys? A filter. But the organ is very good at reclaiming things that might have gotten past the filter. So when there's inflammation, that filter mechanism doesn't work as well. And proteins, in addition to red blood cells and other things, will leak out into the urine. And when patients develop lupus nephritis, they might have a change in the color of their urine. Their urine might behave differently when it hits water. When there's a lot of protein in the urine becomes foamy. Sometimes it's like bubble bath, actually. The urine, if it's tested by the doctors, might find that there are certain cells in the urine, red cells or white cells. So each of these are symptoms and signs of lupus nephritis. So if someone with lupus develops nephritis, we do get worried because obviously the kidney is an essential organ, and the kidney and the heart and lungs are tied together. So it's very important to get inflammation under control early, because one of the key goals in lupus is to recognize the disease early. And unfortunately, there's a delayed diagnosis, and we think about 4 to 5 years on average for folks who might have signs and symptoms of lupus actually receive a diagnosis. And in some instances, those patients already have nephritis. So it's really important to understand the diagnosis, and we will often treat them aggressively to minimize damage.